Hello, you're tuned into COVID-19 updates on The Wire.
After recording over 90,000 cases for 2 straight days, India recorded around 75,000 new cases on Tuesday. At present, India has 8 lakh active cases, while 33 lakh people have been treated and discharged. The recovery rate has risen to 77.65%, while the fatality rate stands at 1.7%. Only the United States, where more than 61 lakh people have so far been found to be affected, is ahead of India. For the first time, COVID-19 cases in Maharashtra are growing at a faster rate than national average. The daily growth rate in Maharashtra has gone up to 2.21%, while at the national level this has remained at 2.14%. The rise in Maharashtra's growth rate is vital to note because the growth rate of Maharashtra contributes to the national tally significantly. And if Maharashtra continues to add new infections at an alarming rate, the national growth in terms of daily COVID-19 cases will keep seeing an increase as well. Amitabh Sinha's analysis on the Indian Express shows that Maharashtra itself seems to be driven by Pune, which has been reporting more than 4,000 cases for the last few days, the highest in the country. The total number of infections in Pune crossed the 2 lakh mark on Monday. Its infection count is more than Delhi and Mumbai and is also more than every other state except the top 5 with maximum caseloads. The reason for infections growth rate in Pune have been attributed to greater spread of the virus, which the seroprevalence surveys in the city have pointed to. Less effective containment measures and higher testing are also some of the reasons for this growth. But it is also important to note that while testing in Pune is high, it is still not the highest. Delhi is testing more people than Pune. Months into the pandemic, several lapses in the implementation of containment, surveillance, and clinical management strategies for COVID-19 have surfaced in many states. And the union government has received detailed feedback from district level officers. The story was first reported in the Indian Express. In the first week of September itself, India added over 6 lakh new cases. The newspaper has learned that the center has now moved away from addressing states at the level of their health secretaries and has instead begun to communicate directly with administrative officials and the chief medical officers. In the course of several long meetings with the officials, the center found glaring discrepancies in containment and surveillance strategies. The center has now prepared 2 surveillance manuals, one for surveillance officers on the ground and other for supervisors monitoring the teams. After 277 laborers tested COVID-19 positive from 2 construction sites managed by PSP projects, the Ahmedabad Municipal Corporation issued a show cause notice for flouting social distancing and other COVID-19 norms. The urban local body has given the construction company 3 days to respond to the show cause notice as to why they should not be penalized 1 crore rupees for flouting the norms to be followed with respect to construction sites. The 3 leading vaccine candidates by Pfizer, Oxford AstraZeneca, and Moderna are currently undergoing late stage trials, and it has become evident that a vaccine would be made available this year itself. On the 8th of September, Russia released the first batch of its Sputnik V COVID-19 vaccine for public use. According to World Health Organization, about 175 vaccine candidates are in preclinical or clinical trials at present. About 33 of them are in the clinical trials phase. 8 contenders are in final stages of phase 3 human trials. In India, at least 8 candidate vaccines are being developed, of which 2 are in phase 2 trials. Researchers in the United States have found that chest x rays could aid in rapid diagnosis of COVID 19. Radiologists at Louisiana State University Health Sciences Center conducted a retrospective study of nearly 400 persons under investigation for COVID 19. They reviewed the patient's chest x rays along with concurrent RT PCR tests. Using COVID 19 imaging patterns, they categorized each chest x ray as characteristic, non specific, or negative in appearance for COVID 19.
Thank you so much for tuning in. Keep reading and watching The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.